Hello, everyone, and welcome to today's virtual Lunch and Learn. My name is Marie Slife, and I am the practice liaison at Retina Consultants of Nevada. Just a quick note before we begin, we are recording today's webinar via Zoom. If you, for any reason, do not wish to continue with this webinar, feel free to drop off at any point. There will be a Q&A portion at the end of the presentation. Please utilize the Q&A feature for this at the bottoms of your screens. Our presentation today will be focusing on nutrition and the retina, and we have Dr. Charles Calvo presenting. Dr. Calvo was born in Southern California and was raised in Boulder City, Nevada. He received his undergraduate degree from the Honors College at University of Nevada, Las Vegas, and graduated magna cum laude. He received his medical degree from the University of Nevada School of Medicine and received the Outstanding Student in Surgery Award. Dr. Calvo completed his ophthalmology residency at Wills Eye Hospital in Philadelphia, Pennsylvania, where he co-edited the 7th edition of the Wills Eye Manual and was chosen to serve as co-chief resident in his final year. Following residency, he spent a year with the Indian Health Service providing medical and surgical eye care to the Native Americans in Arizona. He then completed a vitreoretinal fellowship at the Moran Eye Center, University of Utah in Salt Lake City, Utah, where he received the Fellow of the Year award. Dr. Calvo specializes in a variety of medical and surgical conditions of the retina and the vitreous. Dr. Calvo is board certified by the American Board of Ophthalmology and an active member of the American Academy of Ophthalmology and the American Society of Retinal Specialists. And now here is Dr. Calvo.
All right. Well, good afternoon, everyone. Hopefully you guys can see me and you guys can see my presentation there. Are we good, Marie?
Yes, you are.
Okay, awesome. So I wanted to get together this afternoon and share with everyone a topic that I'm passionate about, which is the dietary chemicals and components from our diet that have an impact in vision and the health of the retina. And I became interested in this during my fellowship. I worked with a researcher and retina surgeon up there named Paul Bernstein. He happened to be the world's expert on macular pigments and other biochemistry of the retina. So I wanted to acknowledge Dr. Bernstein in this talk, because I have a lot to thank him for exposing me to this topic and the research that we did together. So let's go ahead and get going. All right. Okay, so nutrition, as it is in many other tissues of our body, is very, very important for health. So a healthy diet or a lack thereof has significant implications on the health of the body, but particularly of the eye and the retina. So all metabolic diseases can lead to vision loss in some way or another. So we know that diabetes can cause diabetic retinopathy, and that's a leading cause of blindness in working age adults. Hypertension causes damage. Atherosclerosis, which is hardening of our blood vessels from diet and high blood pressure, can lead to things like retinal artery occlusions and vein occlusions. We can have strokes that can affect the part of the brain, the occipital lobe that does our vision, as well as we can have strokes to the retina. And then obesity can actually change the anatomy of the eye and around the eye. So there are critical nutrients for sight. These are phytochemicals that have a crucial role as an antioxidant and in filtering phototoxic blue light radiation. And these are called macular pigments. So macular pigments makes up the macula lutea. So what the macula is, first, let me define that. If you see on the bottom left photo, this is a photograph of the eye, and the macula is the central part of the retina that gives us our central vision. It's what gives us our vision that for reading, driving, looking people in the face. And you can see that right here. This is the macula. Now over on the right side, here's a histology and anatomy section where you can see there's an eye that has been sectioned in half, and you see that there's this bright yellow spot right there in the middle, and that's the macula lutea, which is the yellow spot. And that actually is an accumulation of macular pigment. So it's in such high quantities that you can actually see it with the naked eye when you look at an eyeball. And the other thing that's interesting is this macula is only found in humans and in primates. So while most animals have eyes and they can see to certain degrees, well, we only see macula lutea in humans and primates. So where do we get these macular pigments? Where do they come from and how do they get inside the eye? Well, macular pigments are made up of carotenoids. And what carotenoids are, they're phytochemicals. And in the retina, the three main ones are lutein, zeaxanthine, and mesozeaxanthine. And so I think that many people have probably heard of lutein before, but lutein is one of the three most important carotenoids that make up the macular pigment. And humans cannot synthesize carotenoids. So this is very important. Our bodies cannot make it, so 100% of it will come from our diet. And carotenoids are made by bacteria, algae, fungi, other plants. So as I will, go forward and speak about, the dietary consumption of macular pigments are extremely important to our vision and the future health of our eyes. So there is an important relationship between carotenoids and macular degeneration. And macular degeneration, as many of you have heard of, you probably know someone that has that or have seen commercials about it, but it's the most common cause of blindness in the retirement age population, so people that are in their 60s or older. And carotenoids have been shown to protect against the development of age-related macular degeneration. So there have been many studies that have shown that if people have low concentrations of carotenoids in their blood, or low macular pigment density, so like density of macular pigment as measured in the macula itself, these people are at a higher risk of developing macular degeneration. So what foods can we find these carotenoids in? Well, currently we know that there are about 750 different carotenoids in nature, but only about 40 of them are found in major foods that humans actually eat. So green leafy vegetables make up the most important category for obtaining carotenoids in our diet. So that's spinach, parsley, kale, lettuce, broccoli, zucchini. Seaweed is also another one that's rich in carotenoids. So outside of the green leafy vegetables, we have orange and yellow fruits. So oranges, tangerines, papaya, mangoes, those are all good sources of it as well. So then we have durum wheat. So durum wheat is not the type of wheat that you would have for like bread, for example, but durum wheat is a type of wheat that's used in some types of pastas. You can see it in corn, and some of their byproducts also can contain lutein and zeaxanthine, but the concentrations are not as rich as they are in the green leafy vegetables or orange or yellow fruits. And as you've noticed, I haven't said any animal sources yet, and this is for good reason. You know, the majority of carotenoids are actually found in plant-based diets, but there are some animal sources of carotenoids. So lutein and its isomers can be found in egg yolk. So if you look at this photo here of this egg yolk, you can see it has like a really rich, like a deep orange color. And so you can tell that chicken had a diet that was rich in carotenoids, and then that's transferred to the yolk. As an example, if you've gone and if you've ever bought like really cheap eggs before, like, you know, you bought eggs from like a gas station per se, and you crack it, and the yolk looks really, really light yellow or maybe even clear, that tells you that the nutrition of that chicken was not great. And on the other hand, if you've ever had like free range, or you buy eggs that are from like a farmer, or a farmer's market, and you crack open those eggs, that yolk will look really, really rich. And so that's the lutein and other carotenoids that the chicken ate from a natural diet, and then that's then transferred to you through that egg. Other places you can find it: fish skin, shells of crustaceans, and then some of the skin and joints of birds. So like I said, not things that usually we don't eat fish skin or crab shells every day, but probably egg yolk is the most relevant source in animal base. So the third of the carotenoids, or the macular pigments, the carotenoids in the macula, is mesozeaxanthine. And mesozeaxanthine is uncommon. It rarely exists in the human diet. Really, in the 80s, they found that mesozeaxanthine does exist in shrimp shells, fish skin, and turtle fat. Like I said, is not something that humans usually eat. So the way that we get it is it's actually converted in the RPE. So one of the pigment layers of the retina, there's an enzyme called RPE65, and it converts lutein into mesozeaxanthine. So let's talk about age-related macular degeneration for a minute. So this, as many of you know, is an acquired degenerative disorder of the macula. It's the leading cause of blindness or low vision, visual disability in people that are greater than 60 years of age. AMD does account for nearly 9% of legal blindness across the globe. And here's an example on the bottom left. There's a photo of a left eye of the macula there. And as you can see, there's all these almost like crystal refractile yellow deposits. And those are drusen. Those are kind of the hallmark of macular degeneration. Those are waste products that have built up in the retina. And then over here on this photo, this is kind of a representative image of what one would see if they had advanced macular degeneration. As I said, the macula gives us our central vision. And you can see if you have degeneration of the central vision, the peripheral vision will look okay, but the central area will be distorted, or there'll just be complete loss of vision there in the center. So AMD, it's a very complex disease. There's many genes that are involved. We don't have a great grasp of the condition, but we do know that oxidative stresses, excessive light exposure, poor nutrition, high cholesterol, and high blood pressure are strongly correlated with this disease. And as I said, this is called age-related macular degeneration. So this is something that happens as people get older. Advanced age is an obvious risk, and there's a sharp increase in prevalence of AMD in those that are 75 years or older. There's other risk factors that we can't change. So we can't change your age. You also cannot change female gender. That's a greater risk. Light complexions. So if people have a light complexion, like Caucasian light skin, the back of the eye is also lightly pigmented and does not have as much kind of sunblock, if you want to say. And then light color eyes are also a modifiable risk factor. So what are ways that we can help prevent macular degeneration or decrease the chances? And so, like I said before, we can't change certain risk factors. Like, you can't change your age, you can't change what gender you are or the color of your skin, but there are some modifiable risk factors. So smoking is one of the most important environmental risk factors. And it's an important question that we ask patients when I see them for macular degeneration is, do you have smoking? And I will, anecdotally say that AMD tends to be more advanced, more severe at the time of presentation in those that smoke. And epidemiologic data does suggest that if patients have a higher blood concentration of these antioxidants, they'll have a significantly lower risk of developing neovascular macular degeneration. So how did we learn all this stuff? Well, we learned it because there was a large study that was done called the Eye Disease Case Control Study, where they compared 350 patients that had macular degeneration to 520 people that were matched by, so similar ages, similar geographic areas. And these 520 people did not have macular degeneration. And they wanted to identify the relationship between their diet and the risk for AMD. So the study determined that an increased dietary intake of carotenoids, particularly spinach and collard green, were strongly associated with the decreased risk of macular degeneration. And the significance of that risk difference was that there was a 42% decrease in risk between the highest group of carotenoids in their diet to the lowest. So that's a pretty significant change based on diet habits. One thing that's interesting, patients always ask me, well, what about vitamins? What about vitamin C? What about all these other ones? Well, this study did not actually show a significant benefit of vitamin A, C, or E. However, there was a trend in risk reduction. It wasn't statistically significant, but there was a risk reduction in high vitamin C intake from food sources. And that's the caveat there, from food sources. So actually having it with the fiber and all the other stuff of, an orange rather than just getting it from a bottle. So many people who have macular degenerations, or hopefully all the people that have macular degeneration, and many people that don't, they take the over-the-counter eye vitamins. And I know probably many of you have seen them before. You see the commercials for like Preservision or eye caps, or there's many brands. Well, those vitamins, they're called AREDS. Well, where did those come from? How did they figure out why those work? Well, what that actually stands for, AREDS, it stands for Age-Related Eye Disease Study. And so the National Eye Institute in 1990, they called a meeting together and they wanted to figure out if supplementation with antioxidants would alter the development or the progression of macular degeneration. And so what they ended up doing is they created this a very, very high quality study. And that's very important in science, that the study is well constructed. This is about as good as it gets in terms of science. It was a double mask randomized trial, and they were enrolled at 11 different centers around the United States. And the people that were enrolled were people that already had macular degeneration of various degrees in one or both eyes. So what they ended up putting in that first formulation of the vitamin was selected through the recommendation of an expert panel of nutritionists, biochemists, ophthalmologists at the National Eye Institute. So they put beta carotene in the first formulation of this vitamin. And that was because lutein and zeaxanthine, they weren't commercially available in the 90s. It was not something that was easily made and sold in laboratories. So it was hard to have that available for the study. So they used beta carotene instead. They put 500 milligrams of vitamin C, 400 international units of vitamin E, and then they also put zinc oxide. And then copper is also in there, cupric acid. Copper oxide was in there to prevent a copper deficiency anemia. So at the 5-year mark, the probability of progression to advanced macular degeneration was 20% for those that got the vitamins, and then 28% of those that got the placebo. So that ends up to be about a 29% risk reduction of the development of advanced macular degeneration, which is a significant reduction in risk. It's not, not a 100% reduction, but it is a significant reduction. So as you can see now, or if you see now at the grocery store, if you're looking through the aisle, you see that they all say AREDS 2. Most of them say AREDS 2 now. Well, there was evidence during the course of the AREDS trial that beta carotene was associated with an increased risk in lung cancer if you smoked. So that raised concerns about including beta carotene in these vitamins, since like almost 50% of the US population that was at risk for AMD were current or former smokers. So they wanted to get that out. So beta carotene was replaced with lutein and zeaxanthine, which became commercially available in 2001. So that was AREDS 2, as lutein and zeaxanthine rather than beta carotene. So this formulation has now become the standard of care for those who are at risk of visual loss from macular degeneration. So the AREDS 2 study was started in 2006. And they also, in addition to adding the lutein and zeaxanthine, they added the omega-3 long-chain polyunsaturated fatty acids into the formula. So, and then there also was evidence from the first study that high doses of zinc may have resulted in some genitourinary related hospital admissions, some like urinary infections and some other issues. So that's why a lower zinc concentration was placed into the second trial. Now, other supplements. So I have patients that ask me these things all the time. You know, what about herbal supplements? What about alternative medicines, anthocyanins, goji berries, saffrons? If you Google online about these things, you'll see that there's a lot of information that's out there on the internet about these alternative herbal supplements. And you know, there is data. If you search on PubMed about you know, legitimate research, legitimate data, there is information that may suggest that these supplements could have a positive benefit. However, with these small studies, they don't have the safety and oversight like the large AREDS studies. So the pharmacokinetics, the safety and the efficacy of these substances are really unknown. There has not been extensive amount of attention given to looking to see if there are interactions between these supplements and other medications. Like if you take an herbal supplement, what's it going to do with your blood pressure medicine? What's it going to do with your Coumadin? What's it going to do with your seizure medication? So there's lots of unknowns with these. You know, there is a potential that these could have some effect, but right now there's lots of unknowns. And so that's what I counsel all my patients, that you know, they may have a benefit, but we don't know, but there's a significant risk and a significant unknown with taking those medications. So what's in the future for the nutrition of macular degeneration? Well, mesozeaxanthine is now commercially available. In the previous, the AREDS 1 and AREDS 2, it was not commercially available and it was not included in those formulations. So it is commercially available now. However, there are questions on how should it be used? What would be the appropriate dose? In other research studies that they have used psychophysical testing compared to placebo, it has shown that mesozeaxanthine does confer some benefit to vision, but we have not had a big study like the AREDS study to test what its impact is on the progression of macular degeneration. And so that would make sense. It's logical that mesozeaxanthine should be included in a treatment arm if they ever did an AREDS 3 trial. Now, long-term studies could potentially be used to define at what point in an individual's life should you be starting these supplements. Like, should you start it once you get macular degeneration? Should it be started a year before? Should it be started 5 years before, 10 years before? Should kids take them? There's lots of questions that these studies open up. And so we don't have any data to suggest when supplementation should be implemented in a person's life. But the one thing that we can say, and the conclusions, you know, it's written here, is that a healthy diet and lifestyle are very important. Remember that these supplementations that we're getting, the AREDS supplements, all of these are found in diets. That's where they're from. And so that question of when should supplementation be started? Well, this is, you know, there's no risk. There's essentially just lots of benefits to having a healthy diet, to having a diet that's rich in green leafy vegetables, to having yellow and orange fruits, eggs, seafood. All of these things should be incorporated into our life. You know, if you're someone that eats, you know, meat and potatoes, you're missing out on carotenoids almost entirely, and that one would want to guess, or one would make the assumption that that very well could cause you to have some issues later in life in terms of macular pigment and other diseases like macular degeneration that may be involved. And then lastly, smoking cessation is very, very important. As I said, this is a huge risk for macular degeneration, and smoking causes, you know, so many cancers, pulmonary diseases, everyone knows that smoking is bad, so I don't need to tell you that. But in this condition, it's particularly important to stop smoking. So when I tell my patients, when I give them the macular degeneration talk, we talk about stopping smoking. We talk about having a diet that's rich in colorful vegetables. We talk about a colorful plate. Your plate of food for lunch and dinner should not be brown. It should not just be a bunch of brown foods. It should be colorful foods, spinach, peppers, broccoli, kale, oranges, mango. All of those bright, colorful things are very, very important to your diet. So colorful plate is important. And then lastly, there is an important role for the supplementation with the AREDS vitamins. And that is it. So thank you. Marie will open up for some questions that we can answer a few questions in the time we have remaining.
Thank you, Dr. Calvo, for taking the time today to share the nutrition and the retina and how important it is to be mindful of our retinal health. For more information about who we are, please visit our website at www.retinanevada.com. We are currently open to all in-clinic appointments and have been monitoring and following all safety regulatory guidelines regarding COVID-19. To schedule a visit, please call our office at 702-369-0200. We now begin our Q&A segment, and we apologize in advance if we are not able to get to all of the questions today. So the first question I have here is, can those undiagnosed but have a family history of AMD take AREDS to prevent future development?
Yeah, that's a good question. Thank you. So I think having a strong family history is a good reason to be on top of your retinal health. We do know that there are complex genetics that are involved with macular degeneration. The genetics are a little difficult to understand. We're still working to try to have a better understanding of them. But one kind of general kind of point that has been noticed is that oftentimes genetics tend to run through the mother's side of the family. So if your mother's mother and mother's side of the family has a history of macular degeneration, then you should pay probably even more mind to your macular health. But yeah, so the vitamins are over the counter. These AREDS vitamins are over the counter, and they are a very low risk. So in these AREDS studies, the way that the study was set up and the way that the study was powered, they didn't recommend the vitamins in people that had no macular degeneration or very early macular degeneration. I don't know if that study was done today, if they would still say that. Things have changed with time. But I would say, personally for myself, if I had a strong family history of macular degeneration, I probably would lean towards having supplementation, because these vitamins are very low risk. It's a combination of, like I said, lutein, zeaxanthine, zinc, copper, vitamin C. These are levels of medication, of supplements that are found in our diet and other supplements. So if you had any concern, I would always make sure to run it by your primary care doctor to look at other medications that you're on. But it's very low risk to start these medications. But once again, I would probably focus more on having a diet that's rich in carotenoids rather than relying on the pharmaceuticals. But yeah, I don't see any problem with starting AREDS supplementation if you have a family history of it.
Thank you. Another question. Can eye injuries or any other eye diseases cause AMD?
Oh, so that's a good question. So no, other eye diseases and eye injuries cannot cause macular degeneration in itself. Now, however, there are countless types of injuries. There are textbooks full of other diseases of other conditions that can cause diseases in the macula, that can cause symptoms that are similar to, and can even look to the eye doctor to look similar to macular degeneration. But macular degeneration is a distinct disease entity. It's its own thing. So no, getting hit in the eye or getting poked in the eye can't cause macular degeneration. That's a disease that's caused by advanced age, genetics, environmental risk factors. So you can definitely have other things that can cause damage to your macula, but macular degeneration is its own distinct problem.
Perfect, thank you. And then last question for our lunch and learn is, if I feel that I have concerns about my retinal health and haven't seen a retinal doctor before, what should I do?
Yeah, so you can, hopefully if you have a regular or a primary an eye doctor, you can see them. Having a dilated eye exam is crucial for not just macular degeneration, but for countless other eye conditions. And so it's actually recommended by the American Academy of Ophthalmology to have an annual dilated eye exam once you're over the age of 40. So you can talk to your primary eye care doctor about that, or you can just reach out to us, and we would be happy to see patients that don't even have referrals or don't necessarily have an eye history, but we're always happy to give someone a retinal evaluation. So you could reach out to us, and we would be happy to take care of you.
Wonderful. Okay, so that is all the time we have today. Thank you again, Dr. Calvo, and to all our viewers for your questions and for being part of our virtual lunch and learn. From all of us here at Retina Consultants of Nevada, stay safe, be well, and have a wonderful day. Bye.
Bye.